Our final speaker is Dr. Baggot. Dr. Baggot has been a professional medical student, it looks like. He started out with a BS in chemistry from St. Louis University. He has either internships, residencies, or fellowship in surgery, ENT, emergency medicine, obstetrics and gynecology, maternal fetal medicine, and genetics. When we get a call from somebody at one more school that has a unique medical situation, we refer them to Dr. Baggot. Dr. Baggot.
All right, I hope we can figure out how to work this device. Well, following such luminaries, I think I'll completely skip fertility concerns. All right, in 2009, I got a call from this Mexican actor, Eduardo, and he's the star of the movie Bella, and he wanted me to start a clinic in downtown LA, which was an area I was very familiar with. That's where I had started in LA about 10 years ago, in about the year about 2000. Where there's 10 abortion clinics in a 1 mile radius. Okay, let's see if I can figure out how to work this thing. Okay, that worked. If you park your car, you'll get a discount flyer, abortion flyer on your windshield, giving you, so many % off your next abortion. I don't really see this on Caucasian TV, but everybody tells me that if you watch Mexican TV, abortions are advertised. I guess that's one thing I've been spared in my TV watching, is to watch an abortion commercial. As I said, there's approximately 10 abortion clinics. Sometimes we close one and sometimes another one pops up, but somewhere in that neighborhood. In this area, we're in Koreatown. The Koreans are culturally fairly tolerant of abortion. So I'd say most of the Korean OBGYNs do abortions in their office, and others do as well. So 10 is probably an understatement. So you can think of a neighborhood where there's far more abortion clinics than gas stations. We have the famous University of Southern California close to us, and they have a family planning fellowship, which means if you've done 4 years of advanced training in obstetrics and gynecology, you can now learn how to write a birth control prescription and do an abortion. But they serve as a backstop for the abortion clinic. So if you see an ambulance drive away from the back end of an abortion clinic, but you never see anything about that in the newspaper, it's because they take them to University of Southern California, which is, it's like a seminary of abortion. And they have some of the leading self-styled lights of abortion who invent new ways of doing abortions at the University of Southern California. So luckily, I told this to the pro-lifers. I said, if you want to pick at a clinic, pick it this one. So they started to do it. And also we are not even a block from the infamous 6 in Westmoreland clinic, and actually they send us a lot of pictures. LA is a difficult medical economy. Everyone's on Medicus. Governor Gray Davis spent all the state's money on Enron for the foreseeable future. We have the lowest paying Medi-Cal, and then the insurance pay less than Medi-Cal. And so it's kind of like the crime scene for modern culture. People are playing with sex, experimenting with sex, pregnant by accident. Do you remember the guy's name? Not necessarily. Different children, different fathers. 4 children, still not married to the father. It's not my baby. She left the husband in another country. We're both married, sure, but not to each other. No job, no car, no money. And all these problems really come to a head with a positive pregnancy test. So, how could we economically survive in this environment? In other words, if people came to me hoping to get an abortion, which would cost about as much as a $300 car, could I encourage them to keep the baby, which would be more like selling them an airplane? So most of my deliveries and most of my patients are abortion turnarounds. Although when they have made a plan to have an abortion, if they change that plan and now they're going to keep the baby, they may move to another state to live with mom, or so many of them I might not see them again. Or sometimes they go back to the OB that sent them to have the abortion. But anyway, my practice is saving babies, and my strategy is to promote true lasting love, which is what everyone wants, but nobody can seem to find. And so here's my idea for success. Use your fair advantage. Most people desire true lasting love. They're not really finding it in our hookup culture. Many are like the woman at the well in the Gospels. They've had 5 husbands, but they weren't married to any of them. We are not reproductive plumbers, as most of our colleagues are, but we are the doctors to marriage, and we can help couples achieve true lasting love and happiness by promoting pregnancy, natural family planning, preventing miscarriage, treating infertility, and not sterilizing our patients. Recently, I had a patient that she had been insisting that I sterilize her at the time I do her C-section, and I said, well, if it's that important that you need another OB-GYN. And so anyway, when I moved, we both lost track of each other, so I saw her in another hospital. She had her next baby after I didn't sterilize her, and when she saw me walking in the hall, she thought I was the greatest guy in the world. Because by not sterilizing her, I'd given her her most recent baby. So I think we should not be intimidated. We should not believe any type of nonsense that we stewed for not doing a sterilization. It's actually the best thing you can do for a patient. Okay, so how do we do this? We have a good relationship with a crisis pregnancy center called Los Angeles Pregnancy Services. By their count, there were 263 babies saved in 2001, and on a good day we might get 3 or 4 referrals. And in this talk, I'm really just going to tell you how I kind of into keeping their babies. Okay. There's other crisis pregnancy centers that help. Sometimes the police refer us difficult cases. The overwhelming majority of my OB practice is turnarounds, and I do in-service talks for the crisis pregnancy centers. So here's what I do to try to save a baby. First of all, the center. Well, the place does look nice, although that's got nothing to do with me. There's a big TV in the waiting room, and it plays Bella all the time. And it's funny, if you watch that movie, after the first 10 times, you can still see great things in it that you didn't miss, that you didn't catch the first time. This office has a concierge. I had never heard this term until I talked to Eduardo's relatives, but a concierge is a room which has a nice sofa. It's there for counseling. There's a VCR. There's whatever videos on the desk you could want, including Bella. And so this room is a home away from home for sidewalk counselors. Sidewalk counselors might have picked up a patient in Long Beach or God knows where, bring them to our clinic. If they need a Bible or a rosary or a VCR, if they want to play Hard Truth or whatever, it's all there for them. And this is their home away from home. In my office, as I'm going to tell you, there are 3 relationships. And in my office, I keep 3D pictures of the baby on the wall so that the babies don't get left out of the discussion because they're one of the 3 important relationships. We do have a fairly large chapel in the back, and so I do run across, patients that I've tried everything and they're just resolute that they're going to have an abortion. So I said, okay, well, there's a lady back here that you can talk to. I don't actually think that I really appreciate or understand. Okay, forget it. I don't appreciate or understand all the details, but there's this image which comes from Mexico. It's signed off by a bishop. It's a accurate, certified copy of the tilma. So some patients will take one look at it and take off, and other patients, they'll start crying. So if nothing else works, that's what I do. How to save a baby with an ultrasound. Okay, so this is what I do when you want to save a baby with an ultrasound. You want to talk to that mother's brain. And that depends on the image projected on the retina in the back of the eye. And so the larger the image that you show her, the more brain cells it talks to. So as they lay on the bed, there is a huge TV, and I magnify the image so that the baby is huge too. And so the baby will fill the screen, and I'll point out the baby's head, arms, legs, spine, and cord. Many of them, they think that if it's not formed, it's not a real baby. You know, the old concept of first it's a vegetable. I mean, of course it's a ridiculous concept, but for them, that's how they think. So I'll show them the head, arms, and legs, and I have this view which is not found in any ultrasound textbook, but you can take a picture which shows a head, 2 arms, and a leg. 2 arms and 2 legs. So that's one picture that I show them. And also, in early pregnancy, like around 6 to 8 weeks, the heart is large relative to the rest of the baby. It would appear that the heart is looks like about 1/3 the size of the baby. And so my ultrasound probe dwells on that. And of course, we are the voice for the speechless unborn. And so the baby cannot say, "Mommy, I love you." But I can. And if I told it to you in Russian, it wouldn't make any impression on you. But if I speak in your language, and in this case I speak in Spanish, then it makes more of an impression. You'll also frequently notice after about 8 weeks, the babies may jump or dance. If you see the hand anywhere near the face, they're sucking their thumb. And if you are careful, you can show that. And anyone looking at this image is going to have an increase in their pulse. That's a physiologic reality. How you interpret that physiologic reality is up to you. Did your pulse increase because you're frightened of what's going to happen, you're dreading, or because you're they know which of these is their valid emotion? They have just to learn it from us. We're happy that they have a baby. Okay, now, this was taught to me, this concept was taught to me by Sister Paula. Maybe it's real obvious for all of you, but it was a new way to think for me. Men think by commandments, propositional logic. Women have another way to think, which is, maybe it's also a good way to think. Maybe it's better. Maybe men would have a lot to learn from this. So when they think about a baby, they think about their father. Is their father or mother going to get angry at them, throw them out of the house? About the boyfriend or the husband. Is he a good guy? Is he the guy they hope to marry, the man of their dreams, or at least not too far from it? Or is he a bad guy that they would just as soon be rid of? If he's a man that is a reasonably good guy, then abortion will be very destructive to the relationship, because if someone were to run over, if your neighbor were to run over your car by accident, you're not going to be able to say, oh, that was just an accident, I know you didn't mean it, we just forgot it. No, that's impossible. So nobody can have an amicable relationship with someone that's involved in the death of their child. If that someone is your spouse, then that's going to have a very destructive effect on your marriage. Or boyfriend, girlfriend, that's going to destroy the relationship. Maybe these things are obvious to us, but we just need to express it to them. And then we also need to get them to think about their relationship to the fetus. When they come in seeking an abortion, they think they don't have any relationship to the baby. But, did you ever babysit? Did you babysit for your younger brothers or sisters? How would you feel if someone would do something terrible to one of your younger brothers or sisters? And then, what if that person was in fact you? So, I try to draw out, in different situations, different of these relationships might work. You know, if the guy's really a terrible guy, okay, drop that. But there will be some relationship that they have that they can relate to. Okay. So let's think about the motherhood relationship. In our society, everyone tells us that motherhood is foolish, you'll wreck your career, and it's even, as dumb as this would sound, selfish. In fact, my mother, who had 11 children, would listen to interminable stupid comments from people telling her, why did she have to have so many children? She had their children, all sorts of things. So, let us give mothers some appreciation for the hard work that they put in and for the accomplishments that they've done. So, I appreciate their accomplishments. In fact, I give them gold stars. I have them in my desk. I pull them out. and I'll give them, if they've had 2 miscarriages and 3 children, I'll give them 5 gold stars. And 2 months later, they still have those gold stars in their purse. So, mothers need to be affirmed and appreciated for the great work they do, just like maybe the priests. So this one lady came in recently. She had 4 children, 2 prior C-sections. She had 2 miscarriages. Her husband said she had enough children. I could see that. And he was working intermittently at best. So the ultrasound shows an 8-week fetus magnified to the size of an 8-week. You can see 2 heads, 2 arms, 2 legs, head, spine, heart, port. The heart is at this stage beating with love and very large. And the baby moved. And she cried and she kept the baby. sometimes a woman will say, okay, I'm going to get an abortion, I want you to pay for it. And the guy will say, oh, okay, here's the money. And she did not want him to do that and will later be terrifically angry with the guy, and that will end the relationship. So, as we have heard, what women say isn't what they really want. What do they want, and what does the guy want? Every guy wants to be the knight in shining armor who will sacrifice everything and risk everything for the damsel in distress. Every guy wants to do that. You just need to give them the chance. So if I can't drag it out of her, then, I'll put it to him myself. And I think ideas coming to a man from a man sound a little different than from a woman. Okay, and so I'll say, can you deny yourself for her benefit? Oh, well, sure. Well, I'd be happy to. Can you get an extra job or maybe 2 extra jobs? Of course. No problem. They just had to be asked, but they couldn't read her mind. Okay, so give the guy the chance to be the knight in shining armor. Okay, so this is another couple of mine. He was a chef. She went to his restaurant to eat. They became friends. She got pregnant. And he said, what? I'm not ready to be a father. And we can see how this might happen. Before, when she gets pregnant, she's happy to be pregnant. And then when he says that, she's depressed and her hopes are dashed and she wants an abortion. But with little suggestions from me, he realized what his role needed to be here. And then over the course of the pregnancy, their love really blossomed when he decided to be a father and start taking care of her, cooking healthy food for her. And they were the biggest lovebirds, except for some of the other patients I'm going to tell you about. So, when this thing comes together, when they first come to my clinic, it's the situation that could alternatively be described as the shotgun marriage situation. But it doesn't have to be that way. It could be the beginning of something wonderful and beautiful. Okay, another relationship is her relationship with him. So, in order to get this working for me, I may say to her, what did you find initially attractive in him? Oh, I forgot about that. Yeah, there was something I liked about the guy 6 months ago. Or I could say the same thing to her. If we're all images of God, then there was something in that other person wonderful that attracted you to them in the beginning. And then, you could also think about the kids. Do you think the kids would want the parents to get married? Maybe. Or would the wedding, wouldn't that be fun? In our current movies, we do not see true lasting love in our current movies. Most of our current movies, many of the relationships would be more characterized as being pathetic than what we would see in old movies. We have to look at movies from 30 years ago to see true lasting love. But even that people do not see that on TV or in the movies, they still know that's what they want. And this baby could be your chance to fulfill your dreams and find true lasting love. Okay, so this lady, she was a very smart, very hardworking career woman. Russia and prior Soviet republics, abortion was used as contraception, and she was in some ways she's a tough lady, so she had many abortions before because she wasn't going to mess up her career for that. She was a Muslim, and she couldn't really have an Armenian Christian husband like the guy that she got pregnant by. And he was a pensive, chronically depressed, much older man. But if you love him, then keep the baby. Well, I lost that one. She did abort that one, and I didn't find out that until later. I think what happened was her family pressured her to abort the baby. And then she went back to Kazakhstan, and then what I'm thinking is, she told her family where to get off. And then she came back to LA. She got pregnant again with Armenian, returned to me again, and now they're happy as clams. They're sure to get married. Which church, I don't know. There's also the relationship to the other siblings. Do you have any boys? You know, a lot of women, they have a bunch of girls, but they're missing a boy. This pregnancy could be your boy. That idea can save a baby. And about half the time they will be. This could be the boy we always dreamed of. But many women, if they've had two girls, they think, oh, this is hopeless. This is never going to work. Forget it. I'm going to have an abortion. And if you just say to them, well, did you want to have a boy? Yeah, I'd like to have a boy, but I tried that last time. It didn't work. Well, try one more time. Don't you girls need a brother? And wouldn't a boy have so much fun if he had another brother? All right, another thing that I have developed in my clinic, I was talking to one of my priest friends, and one of our ongoing conspiracies is how to defund the abortion clinics. Now, most of my colleagues don't want anything to do with miscarriages, and here's why. You send a patient to the hospital for a miscarriage. It's not an emergency, it's an add-on case. It goes at the end of the schedule. So you could be waiting there forever, and Medicus will not pay you anything, and nobody wants anything to do with these cases. However, I think that when they go to the abortion clinics make a ton of money off of them because they operate as outpatient surgery centers. So I am not getting that much out of this, but I'm defunding them dramatically. All right. So I take care of miscarriages. Miscarriages can be very traumatic to mothers. Many of us, men, might have missed that. The physical pain of having a miscarriage often is relatively trivial. It's a psychological, spiritual, and emotional pain of losing a baby that is the main pain. So my treatment for miscarriage directs itself to that. And if it's not done right, the problem is there are many women that had one miscarriage or they had several miscarriages. They would really love to be pregnant, but they're so afraid of having another miscarriage that while they'd love to have another child, it's not worth risking another pregnancy. So that, I think, is where unresolved grief needs to be treated. So, whereas if it's done right, or according to my program, then after they are done with the miscarriage, they'll be ready to get pregnant sooner or later. And so there you see that healing the spiritual, psychological, and emotional damage allows something good to happen later. So my method of spiritual management and miscarriage, name the baby, keep mementos. With a miscarriage, there's often no mementos. If you have a baby die at term, the mother gets a footprint sheet, booties, hat, lock of hair, all this stuff, which helps them recover from a miscarriage. If I give them a rosary, now they have a memento. And the baby might be dead, but I can still give them a picture of the ultrasound. So they will get mementos. They will pray with their doctor, the parents with their clergy. They need to give their spouse TLC. Miscarriage can be very hard on men. They often won't admit it. Oftentimes the men need a hug too. You can't change the outcome, but you can change how you remember it. In some cases, repeated miscarriages could be an unfortunate strain on a relationship, or it could be bringing the relationship together and strengthening it, depending on how you manage it. So I had this Chinese couple. I think she can hardly speak any English at all. He can speak English. Christians, on their first pregnancy, their miscarriage was very hard on them, but they were really grateful for the spiritual management, and they are now back for their second pregnancy. So, most of our other colleagues, they view themselves as the plumbers of the reproductive system. They can tie it off, they can chop it out, and they can write a prescription. And in a way, it's almost comic how they're missing the whole point. You could read our textbooks of obstetrics and gynecology, and would you find anything in there about marriage or love? It's entirely absent. You know, like, doesn't that have any impact on your work? So, here's how we can use our fair advantage. Everyone is looking for love. If I go to an auto parts store, what I'll see is some tires, and next to the tires is a picture of a scantily clad woman in a bikini. The message is that if you're looking for love, what you need are these tires. It's half right. We are all looking for love, but most of what's offered to us in the name of love, like the casino has loose slots. What's that really saying? But we can offer authentic, true, lasting love. That is what people are really looking for. The thing that you would find in the old movies. We can use that to help women reconsider whether having an abortion is the easy way out or a way to miss out on the most wonderful opportunities of life. And perhaps keeping the baby, while it might seem like a crisis, it could be the beginning of true lasting love. Okay, I got through it.